Good day, this is Professor Wills, CBMD PhD. Today's Friday, March 18th, 2022. It is 12:26 and 21 seconds, a.m. Eastern Standard Time. Today's research, early menopause in women. So let's hop to it here. Early menopause may raise risk of dementia later in life. Date March 2nd, 2022. Source, American Heart Association. Compared with women who enter menopause around age 50, women who experience very early menopause before age of 40 were found to be 35% more likely to develop some type of dementia later in life. And women who entered menopause before age 45 were also 1.3 times more likely to develop dementia before the age of 65. In addition, women who entered menopause later at age 52 or older had dementia risk, similar to women who entered menopause at the average age for menopause onset, which is the age of 50 to 51 years. And dementia involves serious changes in the brain that impairs a person's ability to remember, make decisions, and use language. Alzheimer's disease is the most common type of dementia, while the second most common is vascular dementia, which is a result of disruptions in blood flow to brain cells caused by strokes or plaque buildup in arteries supplying blood to the brain. Both of these types of dementia are more common with age. Diseases affecting specific parts of the brain can also lead to dementia, and a person can have dementia due to more than one disease process. In the current study, the researchers analyzed the potential relationship between age at menopause onset and the diagnosis of dementia from any cause. Health data was examined for 153,291 women who were an average age of 60 years when they became participants in the UK Biobank between 2006 and 2010 were examined. The UK Biobank is a large biomedical database that includes genetic and health information on 500,000 people living in the United Kingdom. The investigators identified the diagnosis of all types of dementia, including Alzheimer's disease, vascular dementia, and dementias from other causes. They calculated risk of occurrence in terms of the age at which the women reported having entered menopause, compared with the women who began menopause at an average age of menopause onset, which is 50 to 51 years. 51 years is the average age for menopause onset among the women in the U.S. The results were adjusted for factors including age at last exam, race, education level, cigarette and alcohol use, body mass index, cardiovascular disease, diabetes, income and leisure, and physical activities. Although postmenopausal women are at greater risk of stroke than premenopausal women, and stroke can disrupt blood flow to the brain and may result in vascular dementia. In this study, the researchers did not find an association between age and menopause and the risk of vascular dementia. And dementia can be prevented, and there are a number of ways women who experience early menopause may be able to reduce their risk of dementia. And this includes routine exercise, participation in leisure and educational activities, non-smoking and not drinking alcohol, maintaining a healthy weight, getting enough vitamin D, and, if recommended by their physician, possibly taking calcium supplements. The researchers suggest that lower estrogen levels may be a factor in the possible connection between early menopause and dementia. The lack of estrogen over the long term enhances oxidative stress, which may increase brain aging and lead to cognitive impairment. Healthcare clinicians who care for women should be aware of a woman's age at menopause onset and closely monitor for cognitive decline in those who reached menopause before age 45. Further research is needed to assess the added value of including the timing of menopause as a predictor in existing dementia models. And this may provide clinicians with a more accurate way to assess a woman's risk for dementia. The study has several limitations. Researchers relied on a woman's self-reported information about their age and menopause onset. In addition, the researchers did not analyze dementia rates in women who had a naturally occurring early menopause separate from the women with menopause induced by surgery to remove the ovaries, which may affect the results. The women used for this study included mostly white women living in the UK and may not generalize to other populations. Good day, this is Professor Will, CBMD PhD, on microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.